and I quote,
That truly lifts our spirit, and this is what we are here for. Good evening, everyone. We wholeheartedly welcome you all to Avenir 2021, a global virtual career guidance program launched by Indian School Al Wadi Al Kabir under the aegis of the Board of Directors of Indian Schools in Oman. On behalf of Indian School Al Wadi Al Kabir, I, Joe Daniel of Class 9 and Zoya of Class 8 take the proud privilege of expressing our profound gratitude to His Majesty Sultan Haitham bin Tariq Al Said for the altruistic and noble benevolence showered on the Indian diaspora in the Sultanate of Oman. We, the Indian expatriates, are fortunate indeed to enjoy a world class quality of life in a country that is modern, peaceful, and full of natural beauty. May the Almighty shower His choicest blessings on His Majesty, and may this nation experience peace and everlasting prosperity. And as the Sultanate gears up and plans for Oman Vision 2040, may we all join hands in ensuring its glorious success. We see programs like Avenir 2021 playing a crucial role in the fulfillment of this vision by guiding and shaping the future of the youth.
welcome to those who believe in the power of dreams and who would like to join us in our exploration of life. It gives me immense pleasure to welcome dignitaries from the Ministry of Education, Honorable Chairman, Board of Directors, Dr. Shivakumar Manikam, and other esteemed members of the Board of Directors, officials from the Indian Embassy, Mr. Agge Joshi, Honorary President of the School Management Committee, Indian School Al Wadi Al Kabir, presidents and members of the school management committees of all Indian schools in Oman and from other schools and boards across the globe, principals, vice principals, heads of various departments, coordinators, teachers, parents, and all the enthusiastic aspirants. Thank you one and all for your gracious presence here this evening. Each day of Avenir 2021 represents different dimensions of multiple intelligence. Silver diamond on day 3 is associated with mathematical logical intelligence. The skill of problem solving and performing experiments will provide ample career opportunities in fields like accounting, engineering, and research work. In a time when the world is at war with the pandemic and millions of people are suffering and dying, there are millions of others who are being heroes and compassionately stepping up to help others, sometimes at the cost of their own lives. Yes, ladies and gentlemen, you got me right. I'm speaking about all those doctors, nurses, hospital staff, and caregivers whom we now know as COVID warriors. The importance of medical professionals has never been more evident than during the COVID-19 pandemic. There are many reasons why students choose to study medicine, from personal calling to job stability. Although everyone has his or her own motivations, there are a myriad of practical aspects that can make medicine a desirable career option. It is with sheer joy and great pride that I take the task of introducing our guest speaker today, a man who dedicated himself to the pursuits of wellness, research, and compassion for others, a man who chose a field in which one needs to put others first. And for him, medicine is truly a service, not just a profession. He is none other than Dr. Sultan Al Maskari. Dr. Sultan Al Maskari is a senior consultant and head of orthopedic surgery in Sultan Qaboos University Hospital, Oman, and is also the president of the Orthopedic Society of Oman. Dr. Sultan Al Maskari received his BSc from St. Andrews University, Scotland, and completed his Bachelor of Medicine and Bachelor of Surgery at Glasgow University, Scotland in 1990, following completion of his orthopedic training in Mersey Deanery, England. He returned to his home country, Oman, in 2002. He established and led the limb reconstruction unit at Paula Hospital, Muscat, until 2008. He moved to Sultan Qaboos University Hospital to establish the orthopedic service, which he is still heading. His clinical interests focus on the lower limb, including reparative and reconstructive techniques, in addition to arthroplasty and complex trauma. He has special interests in bone and joint preservation and regeneration. In addition to reparative procedures such as ACL and meniscal repairs, he has been using autologous tissue regenerative techniques for many years. Recently, he has used bioresorbable, bioactivated, custom made 3D printed synthetic scaffolds to treat large segmental long bone defects. He is keen on close interdisciplinary collaboration and cooperation in this field.
Dear audience, let's hear about the perks of the profession straight from our esteemed guest for today's session, who knows firsthand. Without further ado, let's welcome our guest speaker for today, Dr. Sultan Al Maskari. The platform is all yours, sir.
Thank you very much for the invitation. Let me first share my screen with you, and we will start from there. Let me just go on to my slideshow. Oh. Yep, can you see my slides, or?
Yes, so we can.
Is that showing well?
Yes.
No, I need to go to the top of the presentation so that I don't start with the last slide. Good, so we're there. Thank you very much for the organizers of Avenir 21, and looks very exciting indeed. I am really very pleased with what I've seen so far. And I congratulate you all on this well-organized event. And in particular, I would like to invite my friend, Mrs. Shilpa Pawani, for telling me about Avenir 21. I've titled my talk, A Career in Medicine Fit for the 21st Century, because for you young audience there, for aspirants to enter this exciting field, there has never been a time as exciting as what we're living through now to study and practice medicine. So you're looking, those of you who are hoping to study medicine, you're really looking at a very exciting career ahead of you. And here is an outline of how my talk will flow. I will tell you a little bit about my own personal journey because it represents some of the characteristics that you need to have in you in order to study medicine, and the difficulties that may encounter you along the way. And then I will talk about why do we need to study medicine, or why do people need to study medicine? What does it take to study medicine? How long it takes to study medicine or to become an independent practitioner? Some of the questions, practical questions that will face you or you need to know about. Who can study medicine, or who should study medicine, and who shouldn't study medicine, or what are the reasons that you should not study medicine for, and what to expect in medical school, the career options, and why is it exciting to be a physician in the 21st century. So I hope that you will bear with me throughout this talk. In 1981, I finished my high school here in Muscat, Oman, where we are now. And I was lucky because to earn a scholarship to go and study medicine in Kansas City, Missouri in the United States. So that was quite a transition in 1981. We did not have all the information technology that gives you an idea about the other side of the world that we have now. So it was a cultural move for me in many ways. There was a group of us, there was a group of 15 students. Unfortunately, because of some difficulties that became apparent further down the road, most of these people in this picture decided not to continue to study medicine, and only 4 of us remained, 1, 2, 3, and 4, to continue medicine. However, and I must mention this, even though the United States is the world leading power and science and technology and politics, everything. It has different types of medical schools, and the medical school that we were going to, it turned out later on that would not have been recognized for its degree outside the United States. So that is the first point that I would like to impart to those of you who would like to study medicine, is that first, when you apply to universities, make sure that the degree offered by the university that you're going to is accepted in your country of practice where you intend to practice later on. So from there, I moved on nearly 3 years later to St. Andrews in Scotland, one of the world's most ancient universities, and lucky enough for me, one of the most prestigious universities. Of course, by that time, I would have done a bit of touring, and I've learned a bit of independent skills as a university student, and I've made some friends that I could have a chat in between studying and relaxing with them. And 6 years later, after making some more friends, and having a bit of fun in addition to studying and acquiring my BSc in medical science and finally MBCHB from Glasgow University, and having done 1 year internship in 1991, I moved back to Muscat to start my career as a young medical graduate and choose my further specialties later on. Now, different countries have different rules about what you should do in this situation. For us at that time in Oman, we were mainly following the British system, and the British system demanded that you have to pass certain surgical exams in surgery in general before you can apply for your specialist training. So I passed those in the Royal College of Surgeons of Ireland and the Royal College of Surgeons of Edinburgh. While I was in Oman, I had to travel back and forth to sit my exams. So in addition to working, you have to study for your exams. And then I was lucky enough to be accepted as an orthopedic trainee in Liverpool in 1996. So I moved to the UK again. And of course, at that stage, I was already married and a young person came along the way, but I still had to do my studying and sometimes babysitting and studying and preparing for exams again until I got my final exit exam and certification as an orthopedic surgeon from the Intercollegiate Board in 2002. And in late 2002, I've put here 2003, and moved back to Oman as a fully trained independent practitioner in orthopedic surgery. So that sums up my career path. So from the time I finished my high school until I became an independent practitioner, it took me almost 20 years, slightly more or less, because you have to factor in admissions in Western universities do not take people coming from outside straight into their courses. So you may have to do entrance exams and other foundation courses. Some people do it in less time than that. Actually, most people do it in less time than that. Throughout this presentation, I'm going to quote this great man. He's considered the father of medicine, Hippocrates, who lived more than 2,000 years ago, because the principles and the ethos of medicine remains the same. The technology has moved on, the practice has changed a lot, and there is a lot of cultural variations involved in it. But the principles and the ethics of medicine remain the same. So why study medicine? Hippocrates said, wherever the art of medicine is loved, there is also a love of humanity. And we study medicine to prolong life, to save life, to alleviate suffering, and to preserve function. As physicians, we are trusted by the society, by people who use our services. They give us the trust to their most treasured possession, that is their own body and the body of their beloved ones, their children, their parents, their relatives. And as a result, they hold us in very high regard. And recently, the medical profession, yet again, was voted in an international survey as the most prestigious profession. So if you're lucky enough, like me, to join this profession, you're joining a very unique profession that people all over the world hold in very high esteem. What does it take to study medicine? As you have seen from my own personal journey, it takes a lot of commitment. And to give that commitment, you need to have the right attitude. And this has been also summarized yet again by Hippocrates, when he said, life is short, the art is long, opportunity is fleeting, experience is treacherous, and judgment is difficult. So that summarizes for you that this is not an easy task, but it is indeed a worthwhile task. So in addition to having the right attitude and the right level of commitment, both personal and family and social and financial commitment. So you do need to have somebody to fund you throughout your career until you become an independent practitioner, which takes many years, at least 6 to 8 years. In addition to that, you need to have the appropriate discipline, mental discipline, and ethical and moral discipline to practice and study medicine. You also need to have the appropriate level of ability, intellectual ability. Physical ability, we don't consider that as a barrier. There are many people who have who are physically challenged, but make very good physicians and indeed even surgeons. So physical ability is not a barrier to studying medicine. But not having the right level of mental and intellectual discipline is something that will bar you from studying medicine. So who can study medicine? Now, again, according to Hippocrates, there are in fact two things. There is science and there is opinion. And I will come back to this quote later on at the end of my presentation as well. The former begets knowledge, the latter ignorance. So if you're the type who is opinionated and who has disregard for evidence and reason and logic, then medicine is not for you. Because you do need to respect knowledge and evidence over your own held prejudices and opinions. And again, you need to have the right attitude to respect others for this and for their evidence-based views. You need to have the right personality to be able to be a team worker and mix with other people. If you're a loner, then medicine is not for you. You need to have the right intellectual ability that combines excellent scientific knowledge and mind with an artistic approach, because we use science to enable us to deliver the appropriate treatment for our patients. But delivery of treatment, getting the right diagnosis is an art, and that varies from one practitioner to another. And you rarely have a profession that needs this combination, like medicine. Who shouldn't study medicine, I think, is more important. First of all, if it's someone else pushing you to study medicine, then medicine is not for you, because it's a very long path. And I have come across students and people who were studying medicine simply to please their parents. And that's such a great sacrifice. For you to do it personally is one thing. For you to sacrifice other people's well-being, and that is your patients, simply because you're not happy in your medical practice because you're doing it for someone else, is something different. So if you are not doing it because you're passionate about the field yourself, please don't do it. Don't do it for money. While you will have a safe income and a good enough income as a physician, but money should not be the primary aim. And when you look at the list The wealthiest people in the world, you don't see doctors or physicians amongst them. Don't do it for glamour, because you need to respect your patient's privacy and well-being to be your top priority rather than your own conceited needs. And don't do it for power. If you're doing medicine for one of these reasons, don't do it. And the profession will pick you out very early on, and you'll be counseled about it. If you like to be alone, if you don't like to be with people, if you don't like dealing with people and hearing people's problems, then medicine is not for you. Maybe you should go into sciences that contribute and pour into medicine. If you do not have the right appropriate intellectual ability or the mental and social discipline to be able to continue the field for many years, then avoid studying medicine. Now, what are the entry requirements? Here I tried to be as general as possible, because different systems, different countries have different requirements. Different universities have different requirements. Suffice it to say that medicine is amongst the most competitive fields, probably the most competitive field we can think of. Most universities will take only a small percentage of applicants. In high school, you need to have studied chemistry. That's a definite must. Maths at high level, that's again a definite must. Physics is another must, but it can be overlooked if you study, for instance, biology. But biology is also a must, but many universities do not require it per se. But chemistry, maths, and physics are a must. You may have to sit entrance exams depending on which country or which system you're applying through, and you may have to sit interviews. Some countries, medicine is studied as a postgraduate degree. For instance, in the United States, you have to do a different degree before that in, say, biochemistry or chemistry or biological sciences, or even other fields, maybe even arts or English. But as long as you satisfy the entry requirements and then entrance exams, you may be able to study medicine as a postgraduate student. You need to have also some aptitudes or attributes in your own self. And for instance, you need to be a good communicator. You'll be a member of a big team, and you'll need to be able to communicate with your colleagues, with your seniors, juniors, and with your patients eventually. So communication is an extremely important part of our day-to-day practice. You need to be a team player. If you cannot work with a team, then medicine is not for you. You need to also be a problem solver. Patients come to you to solve their problems, to give them a diagnosis, treat them. But it's not all just about treating ailments. Some of those contributing factors to those ailments are social and maybe other problems, and family practitioners and community doctors are very good at that. You also have to have an intellectual ability about using the right level of your knowledge to solve those medical issues and reach the right diagnosis and give the right treatment. What to expect in medical school? Medical school is demanding, and it's usually a minimum of 5 years. Most systems, probably 6 years. In the United States, it's 4 years because it's a postgraduate degree, but it's a very cramped course. And different universities divided into different systems. The classical way is that you study the first 2 to 3 years studying sciences that are basic to medicine, and I have listed some of them here, by no means exhaustive list. You will need to study anatomy, as this has been done throughout centuries, physiology, biochemistry, pharmacology, and the list is long, cell biology, enzymology, etc., etc. And these would have been delivered to you via lectures or laboratories, tutorials, and you will have to submit reports, etc. And you would sit many exams, written exams, MCQ, multiple choice questions exams, vivas, practical exams, essays that you have to submit, and so on as evaluations. And then there are the clinical years, which are either 2 or 3 additional years, where you rotate through the various clinical disciplines, internal medicine, surgical specialties, general surgery, urology, orthopedics, pediatric surgery, etc. Pediatrics, all these ENT, that's ear, nose, and throats, ophthalmology, and so on, all the various clinical disciplines in various settings. You will attend some lectures and you will give some presentations, and you will attend bedside teaching in different settings, for instance, in inpatients in the ward and outpatient clinics, or in the operating room, in the emergency departments. And again, you will have continuous and variable assessments, written assessments, MCQs again, vivas, clinical practicals assessments, and you will have to maintain a logbook in most systems. And at the end of all of this, you will have a final MD exam where you will be examined on all the disciplines that you've studied throughout the years, and you've already been examined, but we put them all together and we evaluate you to see if you're ready to go out in the community and practice. And also during your medical school years, most universities encourage you to travel abroad to do electives so that you get a different view of medical practice and medical education, or sometimes you can do those internally if you don't have that opportunity to travel abroad. Now, how to become an independent practitioner? Again, that's a lengthy procedure. Once you've graduated from medical school, you're not yet ready to become an independent practitioner. You have to do internships, which are usually 1 year. It varies from one system to another. Most of the places, they require you to do 2 or 3 different specialties over that year under supervision. You've just learned the language of medicine, you've learned the principles, and now in practice, you will be instructed what to do, and you're shadowing your seniors. Once you finished your internship, you get your license to practice. Now, again, it differs from one country to another. License to practice doesn't mean that you go out in the community and set up in your practice. In most countries, you will not be allowed. You still need to undergo specialist training, even if you're going to become a general practitioner, which is family medicine and family and community medicine. Even in those settings, you have to go through specialist training programs. And these specialist training programs have selection exams that you have to sit and compete because the opportunities are limited. There are about 30 to 40 different specialties that you can choose from, and different people have different interests. At the end of these training programs, which usually run between 4 and 6 years, you will sit an exit exam, or a board exam. Once you've done that, you get your specialist license. But even those specialist areas, there are subspecialties. And to be competent in a subspecialty, say like myself, I'm a lower limb surgeon, I had to do further fellowships in lower limb reconstruction and arthroplasty. And that takes at least 1 to 2 years. But once you've graduated, once you've gone through your internship, you're actually a paid practitioner. So you're not doing all this without any pay. No, you're paid and you're in a secure job usually. It's very competitive, but you have that opportunity. So you can support a family if you wish. Now, other requirements that stand you above other people to compete for your choice specialties is to conduct research, which may require you to take some time out to do that. You would have had produced some publications. They have given many presentations at local level or international and regional levels. We put a lot of emphasis on quality assurance, so you would have had to conduct audits and conducted many morbidity and mortality meetings to make sure that we minimize any mismanagement, any complications. And you would have also been required to give some teaching to undergraduate and postgraduate trainings. And you would have been evaluated on your ability to collaborate with other team members within your institute and outside, and within your team and in the extended departments within your institute. So it is quite an extensive field. Now, what are the career options that await you after you finish as a specialist, trained specialist, which takes you at least 10 to 12 years from graduating? You can work in an academic setting like myself at Sultan Qaboos University Hospital, or you can join a service hospital, which usually is run by Ministry of Health to provide services for the people of the country. Or you can join a private practice. Either you set up your own private practice, or join a group of practitioners, or join a private hospital or group of hospitals. Or indeed, you can join a charity, and many people do that, either full-time or part-time, where there is a lot of need for charitable, because there are lots of people around the world who unfortunately cannot afford to pay for treatments. Yet they're still human beings that we have to value and cherish their lives and help them. And sometimes, all the time, sometimes during times of crisis, for instance, an earthquake or flooding or disaster, natural disasters or wars. So medics' role is needed all around the world. Now, why is it exciting to be a physician in the 21st century? Again, I take you back to the great master, Hippocrates. He has a famous saying that what cannot be cured with medicine is cured by knife. What the knife cannot cure is cured with the searing iron. But I've put a cross across the searing iron. We don't practice that anymore. Witchcraft and traditional healers probably do that. And whatever this cannot cure must be considered incurable. Here, the great master and I, in the 21st century medicine in practice, we part company, because the 21st century has brought in huge leaps in technological advances. We have great advances in genetics, in chemistry, in cell biology, in physics, in material sciences, and so on. And this list is by no means exclusive. There is a huge, great number of fields where we have made advances. We also have great advances in access to knowledge. So for you as a practitioner, when I started in 1981 in my quest to study medicine, I had to travel to the other side of the world. Nowadays, established practitioners also had to travel, and those trips would have taken them days and weeks and so on. Whereas nowadays, travel is very easy. Telecommunications is available, and information technology made access to knowledge that much easier. Also, documentation. In the past, centuries ago, people used clay tablets. Last century, we used paper for documentation. Nowadays, we use tablets and computers and IT. They're all over the place. And whether to document our notes for our patients or to access knowledge instantaneously, because no one knows everything. And again, one of the principles that have been set more than 2,000 years ago and stated by Hippocrates, as to treat your patient properly, you need to declare the past, you need to diagnose the present, and foretell the future. We call that prognostication. You need good documentation and access to that knowledge. Now, in the 21st century, and the internet and other technological advances have brought upon us great attitudes and cultural changes. People no longer have the same expectations as they did 20 or 30 years ago, including yourselves, and you shouldn't. You should expect things that are fitting for your generation and for your time from your physicians and your doctors. You come to our consultation rooms as informed clients. Many of you would have searched Google before they come to see people like me. And we have confluence of technologies, 3D printing, electrospinning, etc., robotics that are coming into our practice. This is 3D printed organ. We have virtual reality, augmented reality that are coming into our practice. Artificial intelligence, so that practitioners are no longer practicing in isolation. Artificial intelligence is helping diagnosticians to put in together information from many experts and come up with more accurate diagnosis, less mistakes, faster diagnosis, smart implants, and the list will grow. And it will be made to grow by your generation, if not mine. So you're practicing in a different time. We don't use the searing iron anymore. We use radiotherapy, we use proton beam, we use cyberknife, we use lasers to deliver very fine treatment, precise location. We identify the limits of the disease to the infinite millimeter or nanometer. And this will continue to improve, and it should continue to improve, and it will be made to continue to improve by your generation. We have advances in genetics. Here, BioNTech, the first Pfizer vaccine that is safe enough for your generation, for you people of your age to take, was developed in less than a year from the first case of the pandemic that has disrupted our lives. The last pandemic, flu pandemic, which was in 1919, it took more than 80 years before science was able to come up with a flu vaccine. Yet, with technology this century, in less than a year, we developed a vaccine that was made available to the rest of the world for us to use and get back to our normal life. Again, genetics has enabled people like with this rare disease, which is spinal muscular atrophy, which in the past would have killed children like this young girl. It's extremely expensive, but with one dose, it can cure this child. And there are many other diseases that are awaiting such discoveries, that are awaiting scientists and physicians like yourselves to collaborate in teams and use the available technology that is out there to bring better treatment for our patients. And this is a case from my own cohort of patients. This is a 16-year-old girl. She came to us with cancer of the leg. She needed chemotherapy and surgery. And 40 years ago, she would have had amputation. 10 years ago, she would have not had amputation. We would have removed it, but then lengthened the bone so that we give her back her leg. But lengthening that bone would have taken at least 2 years of active treatment. What we did for her, we brought in 3D printed material, bioresorbable, so that it doesn't stay as a foreign material, it becomes natural bone in time. And we brought in cell biology from her own body and treated her and put this implant in her. And she was walking on her leg the next day. So that's available here. We need to improve on it. We need to go forward. It takes your generation to do that. And so the world is your oyster, young people. Go and get it. Thank you very much for your attention. Any questions?
That was an extraordinary and inspiring session by Dr. Sultan Al Maskari. Thank you, sir.
Thank you.
Dear, dear audience, you are requested to post your queries in the chat box. Our distinguished speaker will answer them in the Q&A session. Now, we would like to request our most honored speaker, Dr. Sultan Al Maskari, to kindly answer a few questions put forth by the audience. Sir, may I now invite a moderator for the session, Ms. Shamita, to share with you the questions raised by our audience.
Good evening, sir.
Good evening.
Good evening. I hope you're doing well.
I am indeed. Thank you very
Good
much.
to
I'm
know.
really honored to be here, and this is such an exciting opportunity.
I do appreciate how you so simply put every detail about being in the medical field so simply for our students. That's really amazing. I mean, everything in detail was too good, sir. Thank you so much for throwing some light on that.
Thank you. It was very easy for me because I thought I would just share my personal experience and add in a bit of the great masters' principles and the difficulties and the trends that one sees around. Thank you.
Yes, sir. Sir, we would like to know what was that thing that inspired you to join this field? And we see a lot of dedication from your end. So we would really like to know what was that one thing that inspired you?
I grew up when I was a child in Oman before 1970. So I experienced Oman when it was not as modern and as developed as it is now. And you see the suffering that people go through, simple things like fever due to malaria, which of course at that time I didn't know that it was malaria. And people die from it, people in pain, people losing their eyesight because of simple things that are preventable like trachoma, children dying. So I said to myself, when I had the opportunity, when Sultan Qaboos, Allah Rahmat, came to power and he made his famous speech, which he said that we will educate our children, even if we had to do it under the shadow of a tree, gave me the opportunity and the knowledge that there is better knowledge out there, greater knowledge, and there is a lot of good. So, and I always had this passion, compassion for other people, that I wanted to alleviate suffering. And I don't think we can put a price on that. And I had the opportunity, I was lucky that the government paid for my scholarships.
We are glad to hear a lot from you, sir.
Thank you.
So there's a question from one of our students. He would like to know how you manage the stress after working hours, especially long working hours in the hospitals. How do you manage your stress?
Thank you. That's a very, very good
Very
question
important
because it is very important and it is a very stressful field. The physical stress is that being there is very demanding, and you must have that ability in you to have that stamina, both mental stamina, which is the main thing, and the physical stamina to be able to do long hours. In the past, the working hours were really bad. Now, most countries have regulated against that. So junior doctors are more protected with this. But once you hand over, before you leave the hospital, you hand over the care of your patient very well to whoever is taking over from you, and you know that the patient is looked after, then you need to switch off. You need to have hobbies. You need to be able to spend some time with your friends. You need to be able to relax. You cannot be on alert all the time. You will collapse and you will be no good to your patients. But the most important thing is that part of handing over your patient's care to someone that has come up fresh and takes over that care. So then you can relax yourself. You will need, unfortunately, to do some work. And even after you've passed all your exams in your mid-30s or late 30s, like most of us, and you already have a family, even now, you still need to acquire further knowledge. So you cannot stop learning. The moment you stop learning, you are not going ahead with the group, but you're actually moving backward. You'll be left behind. So you need to organize your time so that there is time for your work, for day practice. You have some time for your family, and you have some time for yourself. And you have some time for self-development so that you can help your patients in continuing a modern way. So you need to organize your time quite well and be protective of that, including having some fun. You probably may not manage to have as much time to waste for fun as maybe people, friends who are in other fields, but you can have that quality fun time. I hope that answers the question.
I'm sure that answered his question. Yes, so I would also like to know, what was that thing that motivated you during the COVID pandemic? I mean, people were so scared around and worried, but you as doctors always were there for everyone, even though it was such a risky situation.
It was for us in my specialty. I'm an orthopedic surgeon, so we were not at the forefront in managing COVID itself, because we do not deal with that. But of course, we volunteered. So the people who are managing, coordinating the COVID teams selected individuals from different specialties, including my own team. So they didn't go for senior people like me, because we don't have the generalist knowledge or the skills. We can refresh, but it's not as easily accessible to us as our younger colleagues, our trainees. So some of our trainees were taken to that. What we did instead is we tried to develop ways so that we can protect people who don't have COVID and enable them to access us in a protected environment so that we care for them. Because having COVID or dominating the scene didn't mean that people who had other illnesses did not get ill. So people who had cancer, unfortunately, they still had cancer and they still needed treatment. People who have arthritis, and that's the main part of my work, still needed attention for their arthritis. So they needed to have access to us. So we conducted virtual clinics. I used Zoom a lot to consult with my patients and follow up with them so that we minimize the damage and the risk. Also, because we were not able to operate, to do elective surgery, because a lot of our team members had to be diverted and the resources had to be redirected to COVID. We had to put more emphasis on managing their symptoms through other means that we would otherwise have reduced the reliance on. And then also reorganize the hospitals so that we direct people who have COVID to one area and people who don't have COVID to another area. And that way, I think we were able to contribute and maintain our patients. Yeah.
Yes, thank you so much for all your work in this field of humanity. I would also close with the questions. What advice would you like to give our students to join or interest them in this field of medicine?
It's a very, very exciting field, and it's almost coming full circle. If you notice from Hippocrates, and there are many other great doctors, and the simple reason I use Hippocrates because he is considered the father of medicine and most of the principles apply, is that medicine started with medications, herbal medicine, etc., and then surgery was introduced and became more invasive surgery, more aggressive surgery. But now we're going back full circle. We want to do less and less invasive, less and less artificial, become more biological, become more natural healers, but using scientific techniques. So we're using the scientific method. We're using evidence-based approaches rather than somebody's strongly held views or opinions. We challenge that. And this is making it more and more exciting. So now there is the return of the physician scientist or the scientist physician and the collaboration. We work more like an ant colony where there is a group of scientists, engineers, physicists, mathematicians, modeling things and working together, and helped by a clinician who usually is the leader of the team to tell them, look, there is this clinical problem that doesn't have an answer or solution. And we still are far from curing everything. We still have huge numbers of diseases that are not curable. We are in search of cure. And this is what makes medicine interesting and exciting. And it needs your generation to carry it further and dig deeper into that and develop that ethic of working in teams, working with discipline, not wasting resources, not wasting time, but still having fun along the way.
Thank you, sir, for answering all the questions. Thank you so much.
Thank you very much. Thank you very much. It's been a real pleasure. And good luck for the future and good luck for the rest of Avenir 21.
Thank you, sir, for all your support and guidance given to the large audience by attending to their concerns so patiently during the course of the discussion.
Thank you.
Friedrich Nietzsche said, the essence of all beautiful art, all great art, is gratitude. As we have come to an end of this session, I deem it my privilege to put my gratitude into words. It is my pleasure to propose the vote of thanks. On behalf of Indian School Al-Wadi Al-Kabir, the organizing team, and the entire audience, let me first express a profound gratitude to His Majesty Sultan Haitham bin Tariq Al Said for the magnanimous benevolence showered on the Indian diaspora in the Sultanate of Oman. May the Almighty shower abundant blessings on His Majesty and this peaceful and prosperous country of our residence. We extend our heartfelt thanks to our eminent speaker, Dr. Sultan Al Maskari, for all his words of motivation. Thank you, sir.
Thank you very much. One last word, if I may.
Yes, sir.
If any students would like to do job shadowing with me or one of my colleagues, you're welcome. Just get in touch with me, please.
Yeah, thank you so much, sir.
Thank you.
Our deepest sense of appreciation and gratitude to Dr. Shivakumar Manikal, Chairman, Board of Directors of Indian Schools in Oman. Thank you, sir, for your encouraging presence and guidance in all our efforts. Our sincere thanks to all the esteemed members of the various boards of directors, CBSE officials, distinguished members of the MOE Oman, and officials of the Embassy of India, Sultanate of Oman, for their overwhelming encouragement at all times. Our heartfelt thanks to Mr. Alkesh Joshi, the Honorary President, Indian School Al-Wadi Al-Kabir, Management Committee, and other members of the School Management Committee for their profound encouragement at all times. We also wish to take this opportunity to express our heartfelt gratitude to our prudent captain of the ship, Mr. D.N. Rao, Principal, ISWK, Honorable Principals of various schools spread across the globe, Vice Principals, Assistant Vice Principals, Coordinators, Supervisors, and the entire teaching fraternity for their support and guidance. I wish to thank each and every student and parent for their valuable presence in making this session a grand success. We are indeed grateful to our platinum sponsor, StudyCo, gold sponsors, Jain Group of Institutions, Grey Matter Academy, Vellore Institute of Technology, Sri Ramachandra Institute of Higher Education, bronze sponsors, Middle East College, Oman, Thapar University, Thapar Institute of Engineering and Technology, Dallas Baptist University, MIT World Peace University, Pune, digital marketing partner, Spectrum, media sponsor, the Arabian Stories, and valued donors. An event of this kind requires the coordination of a committed team. My earnest and heartfelt thank you to my ISWK team behind the scene, working tirelessly and making Avenue 2021 a tangible reality. Last but not the least, I thank Almighty God for making this session a great success. Thank you all. The next session is a presentation by Monash University, Malaysia. Starts at 7 p.m. Take care and buckle up for the next session. See you soon. Signing off for this session, your compares Joe
and Zoya.